Good afternoon, my dear students. Today I am going to describe the disease condition of the breast. Learning outcome briefly describe the anatomy of the breast, fibroadenoma, fibroadenosis, benign fibrocystic breast disease, acute mastitis, ductectasia and periductal mastitis, pyeloid tumor, simple breast cyst, malignant breast disease. Then let us see anatomy of the breast. The breast or mammary glands are necessary glands of the female reproductive system. They also exist the male but only in a rudimentary form. It means male's breasts are very small or undeveloped, immature. Okay, can you remember what's the location of the breast tissue? These paired mammary glands are located between the second and sixth ribs over the pectoralis major muscles from the sternum to the mid-axillary line and extend into the axillary area of the breast tissue called the tail of Spence and tail of Spence. Cooper's ligaments, which are facial bands, support the breast on the chest wall. The memory, when we are look into the structure, it is this is the location, the clavicle bone. This is the sternum. Superficial of the sternum, and then side of the sternum and the superficial of the chest wall. Chest muscles, those are the chest muscles. Ribs can be felt beneath the skin, and then axillary lymph nodes also can be seen here. Then areola, then this is the fibrous tissue which supports the breast, making them feel firm. Then lobules. There are 20 lobules in the breast, and those lobules produce milk, and then it drains through the ducts to the nipple. The nipple. Nipple is the outer outlet for milk during breastfeeding. Breastfeeding, the areola is dark circle of skin that surrounds the nipple. It is more darkening during the pregnancy periods. We call it as Montgomery's tubercle. Okay. Then the mammary glands of breast contain varying amounts of glandular tissue supported by fatty tissue and fibrous connective tissue that anchor the breast to the chest wall. Each breast contains about 20 lobules. 20, how many lobules? 20 lobules, each of which contains a number of glandular structures called lobules, where milk is produced. Milk is produced in lobules, and then it drain to the ducts to the nipple, then which drains milk towards the nipple. Supported fatty and connective tissues run through the breast surrounding the lobules, and the breast itself is covered in subcutaneous fat. In the lactating breast, glandular tissue proliferates hyperplasia to support milk production and recede again after lactation stops. Nipple. This is a small conical eminence at the center of the breast, surrounded by a pigmented area. The areola, on the surface of the areola, there are numerous sebaceous glands. Montgomery, we call it as Montgomery tubercles. Can you remember the blood supply? Blood supply from the thoracic branch of the axillary arteries and from the internal mammary and intercostal arteries. venous drainage. This is formed by an anastomotic circle round the base of the nipple, from which the branches carry the venous blood to the circumference and end in the axillary and mammary veins. Lymph drainage, this is mainly into the superficial axillary lymph vessels and nodes. Lymph may drain through the internal mammary nodes. If the superficial route is obstructed, nerve supply from fourth, fifth, and sixth thoracic nerves, which contain sympathetic fibers. Okay, then this is also anatomy of the breast. Those are the skin, and then ribs can be felt. Then ribs can be felt. The chest muscles, pectoralis minor muscles, inside that fascia, superficial fascia and deep fascia, and then pectoralis major muscles. Then there are axillary lymph nodes, filter lymph fluid from your breast and help your body fight infection. Always our lymphatic system helps to prevent the microbial invasion into our body. Okay, always axillary lymph nodes are helping to invading the microbes into our body in the breast. Fat tissue, those are the fat tissues, and they are lobules produce milk during pregnancy and breastfeeding. Mammary glands, there are about 18 to 20 lobules in the in one breast, and it also connected to the ducts. The areola is dark circle of skin that surrounds the nipple. Ducts carry milk from the lobules during breastfeeding, and then the nipple is the outlet for milk during breastfeeding. When the child is sucking the breast, it lobules produce milk and excrete through the dust to the nipple. Then milk production. Then fibrous tissue supports your breast, making them feel firm. Then this is the action of muscles. Okay, thank you very much. Hereafter we will talk about the four quadrant of the